Hello and welcome to this edition of COVID Conversations here on WNCU 90.7 FM. I'm Kimberly Pierce Cartwright, your host, and we're using this Zoom platform to talk about how COVID-19 is affecting our world. The coronavirus pandemic has posed multiple challenges to the world, to local governing bodies, to our state, and local bodies have been really key in determining COVID-19 policies as they relate to cities and towns and where people actually live. And today, our guest is Steve Schewel. He is the mayor of Durham, North Carolina. Good day, sir, and thank you for being here.
Thank you for having me, Kimberly. It's always really good to be with you.
So it's my good pleasure. We're months into the pandemic and we're still talking about tracing and face masks and social distancing and those kinds of things. What are some of the first measures that were taken locally when the virus was determined to be a threat to our health?
Well, I'll tell you a story of the very first day. We had our first case on March the 11th here in Durham. On March the 13th, there was a big show scheduled at DPAC that night. And as you may remember, Kimberly, the ACC tournament was shutting down. Broadway was shutting down.
Yes.
And so at that point, I had conversations with the folks at DPAC, and they have contracts with these shows that were coming through all weekend. 2,500 people were going to be there every night, including that night, that Friday. And so the governor's office called, asked if we were planning to shut down DPAC. I asked them if they were planning to shut down DPAC and other big groups around the state. They weren't. So, and the folks at DPAC said, we need a government agency to shut us down so that we won't be sued by all these, touring companies and so forth that we have contracts with. And so at that point, working with DPAC, issued the order to shut down the theater that night. It was really hard because think about it. You had a lot of people coming, including from out of town, but we knew it was a public health emergency. So we made that decision. And that was really the first big decision. And then I realized, wow, we're in new territory here that we've never been in. And then later on, soon after I issued the first emergency orders, the stay-at-home orders, followed by the county that did so, and then the state, and then the mask mandate. As you know, we were the first locality, probably 2 months in front of any other locality in the state, to have a mandate that everybody needs to wear a face covering when they're in public. So those were some of our important early measures. And that face mask mandate, of course, proved to be a really good thing.
And it's a really controversial thing too. So how difficult has it been to get people to change their behaviors to try and control the virus?
Well, as you see when you go out around town, most people are definitely complying. I was out last night having dinner outside at a restaurant under an awning. It was raining, but people had their face coverings on everywhere. And that's what I find. Not everyone is doing it, of course. And so two things that we need to do. One is we need to continue to remind people all the time of the critical importance of wearing a face covering. It just makes a big difference. And what the CDC says now is it's not just good for the people who you're exposing, but it's good for you. It protects you if you're wearing a face covering, as well as the people you love and are around. So that's one thing, is to just get full compliance from people. The other thing is for people that vulnerable populations that, haven't been masking up or aren't masking up, we need to provide as many face coverings to them as we can. So one of the things I'm really proud of is we've given out now more than 100,000 free face coverings on our Durham buses, on our Go Durham buses, which has been amazing. We have mask dispensers there. And so we're really doing everything we can to make sure that our vulnerable populations have face coverings. We have a lot of other efforts too, but that's just one of them. But super important that we get the compliance.
So I know that that you're doing a lot of work. Can you talk about the Recovery and Renewal Task Force? And what does that do?
Yes, that's been real important. County Commission Chair Wendy Jacobs and I appointed the task force several months ago in order to help us, as the title of it says, recover and then renew our community in light of COVID-19. And so that's included, for example, well, let me tell you a little bit about it first.
Yes.
It's got 16 members. It's got the two co-chairs are Katie Galbraith, the CEO of Duke Regional Hospital, and Matisha Sims, who is vice president of Blue Cross and Blue Shield. They've done a marvelous job co-chairing, just a wonderful job leading this group of 16 community leaders. And it's a very diverse group. It represents so many different aspects of the community. And they have pushed forward with a whole lot of different initiatives. There's staff for the task force. Ryan Smith, who leads our city's innovation team, has been staffing it. Brian Fox from the Chamber of Commerce, Amber Wade, who's my assistant, and others. And they've done a wonderful job. So some of the things are, for example, this masking initiative that I talked about. That's something that they pushed. Another thing is called Back on the Bull. And you've probably seen when you go into some businesses, they have the sign that say Back on the Bull. Those are businesses that have gone through our local program of certifying through a website their safe business practices. They talk about the safe practices in their business. Then they print out a sign that goes on the door and it talks about the top 5 safety practices of their business. It's a way to help keep our businesses safe and the people that come into them safe. And then the task force also recommended, in addition to that, which we now have about to have 10 community health ambassadors in the field, going to businesses every day. Half of them are Spanish speaking. And they are going out to businesses to talk about safe practices, to get them to certify through the Back on the Bull campaign. We have a vulnerable populations roundtable from the task force that works with our homeless residents and has strategies to make sure that if there are quarantines, shelters for them if necessary, that we're decongregating our congregate shelters so that our homeless population is not being adversely affected by COVID-19. They're working with our immigrant and refugee populations to speak to them in their languages about the dangers of COVID-19 and to help them protect themselves. So the task force is really a central hub where so much of this work goes on, and supporting our local small businesses, through the funds provided by Duke University and the city and the county. We've had $3 million to support our local small businesses, actually a little bit more than that now. So all those things are kind of coordinated through the task force. It's been a really, really good effort.
Okay, can you give me a list of mandates that are in place in Durham?
Well, our mandates now, so recently we did have our separate local mandates, and we still continue to have our separate local separate local emergency orders that go out periodically. But right now we have come under the governor's orders pretty much. Our orders are almost exactly the same as the governor's orders. We do have a strong mask mandate, but now the state does as well. And so as the state's orders have come to look more like ours, we've kind of gone more under the state's orders. Those are safer at home. You're very well aware of that we really urge people to stay at home as much as they can unless they have essential reasons to go out. It's the masking, the social distancing, and the cleansing, all those things are part of the order. We work to get voluntary compliance with the order. But if people are egregiously violating the order, we get a fair number of complaints about people, at, big outside parties or that kind of thing. If necessary, a police officer will go and gently remind people about the right thing to do. But if it's a business, we have our city attorney will call the business, talk to them about complying. Maybe, if they're not complying with it, let's say they're not complying with the number of people that can be in their business, they're over that mandate. Then we'll have our city attorney call and talk to them about that. If necessary, write a letter to them, and we have other remedies we can pursue. But we really are looking for voluntary compliance because that's the way we're going to stop this thing.
So if there isn't voluntary compliance, then what's the next step?
Well, right now, the only, We'll send a police officer over there and make them comply if necessary. Yeah. There are no civil penalties now available to us, but I think we're going to change that. I mean, we don't want to criminalize this activity, but I think a civil penalty for people who are continuing to put others in danger, I think is probably a good idea.
How are our businesses faring? What is the report that you're getting back from how they're doing with the pandemic in place and mandates in place? What are business owners telling you?
Kimberly, that's one of the worst aspects of this whole COVID situation. And I know you're aware of this as well. The economy has taken a huge hit because we haven't managed the virus. And so we have two things happening. We have some businesses which are prospering and doing well. Look at the stock market going up. But then we have a lot of businesses, especially in the service economy, and in the hospitality economy, rather, who are really suffering. So think about restaurants, hotels, convention centers, these kinds of groups, people that rely on, entertainment venues really taking a huge hit. And in Durham, I saw recently a figure that 35% of our low wage workers are now unemployed. And a lot of them are in the hospitality sector. And so we really have to help bring them back. And those businesses are suffering. We've lost a lot of businesses already that have gone out of business. And we have a lot of others who are on the edge and are trying to survive what we hope will be just, another 6 months, say, before there might be wide availability of a vaccine. And we are trying to help our businesses through that in a variety of different ways. We have a new program called Deliver Durham, where businesses can, there's a delivery service that doesn't charge a fee to the businesses, like DoorDash, which really takes a big chunk out of a restaurant that's trying to deliver. So our local businesses, we're trying to support those restaurants through, a free or very inexpensive delivery service so that they can up their deliveries to different neighborhoods. And we're having neighborhood captains in those neighborhoods to support the businesses. So there's a lot of things like that are going on, but I'll just tell you the truth. A lot of our businesses are on the brink. They've been creative. They've done amazing things to change their business models to stay alive, but there are still a lot of them that are suffering badly. And it's going to be a long time before we're back to where we really want to be. Now, I'm really worried about some of these businesses.
I want to talk now about populations. So who are the people who are being hardest hit by the pandemic?
Well, our Latinx population has been disproportionately affected more than anybody else. There was a time in which fully 80% of our daily cases were among that population, and especially among construction workers, and then they would often bring it home to their families. People traveling to work together, working in close proximity. And you remember, construction work was always deemed essential. That work never stopped. Office work, you can do from home. You can't do construction work from home. I'm home right now. You're home right now. And we're being able to do our work, but you can't do that with construction. And so those folks, also many of them worked for contractors that had no health insurance, or maybe did not have any paid sick time off, continued to go to work. And it really has been a population that's been very hard hit. A huge amount of work through El Centro Hispano and a group called Latin 19 and others has gone into helping our Latinx population be better educated, get face coverings, have the businesses supported through our health ambassadors and others, so that we can really take that on. The second population has been our homeless population. And you know that one of the big problems with right now is that a lot of people can't pay their rent because they're out of work. So this has meant more homelessness. And we've really increased the funding for our street outreach and our rapid rehousing to try to get people into housing. That's worked. We've done very well with that, but we still have the potential eviction crisis on our hands when the moratoriums end at the end of the year, unless they're extended. So we're very worried about that. But there's also been recently there was a COVID-19 outbreak at Urban Ministries, and that fortunately seems to have been contained, but it's meant that we've had to quarantine people who are homeless. We've needed quarantine for them. So all of that is so hard. I mean, the stress it puts on our systems that are already overloaded and the good work that so many people have been doing to keep our homeless residents safe and to make sure that our Latino brothers and sisters get what they need. The other group that's been adversely affected is our African-American residents, especially although their case numbers have not been higher than their percentage of the population. Our African-American residents who do get sick have been dying at a higher proportion than our white or Latino residents. And so maybe I think because probably some of them have underlying health conditions. And so that's been a disproportionate effect as well. Fortunately, now with some of the new drugs, we're able, the death rate from COVID-19 is dropping, which is great. But all of those populations have been adversely affected.
Okay, very brief question. And what can people do to help to get the virus under control? What are your final words to your Durham citizens?
Thank you, Kimberly, for that opportunity. I would say, first of all, the 3 W's: wear a mask, wait 6 feet away from others, socially distance, and wash your hands. Make sure that those 3 W's, for you personally. I do want to say something about the upcoming holidays because I think that's the other important thing. I heard this said on the other day by Secretary Mandy Cohen, our Department of Health and Human Services Secretary for the state, who's fantastic. And one of the things she said is just because you love someone doesn't mean you can't get COVID-19 from them. So we really need to be careful over the holidays. At Thanksgiving, unless you need to travel, don't travel. And I urge young folks who are thinking about going to their parents or grandparents, think about that very hard. Try to do everything you can. If you do go outside, do it on the front porch, do it in the backyard, get your fire pit going in the backyard, sit around that, and do that safely and socially distance outside. I think those are going to be key. That's the way we're going to do the holiday this year, is outside and at our house. And so I think those are some of the things I'd say. And then pitch in, help your neighbors in any way you can. We have a lot of people who are isolated during the virus, who can't see others. Reach out to your isolated neighbors, to your neighbors who live alone, to the elderly neighbors, and make sure they've got what they need, the food they have, the phone call that they need, the little gift dropped off at the door. All those things will help us get through this together.
Okay, thank you, good sir, for your time today. We definitely appreciate your being here.
Well, I love WNCU. I love being here. I've loved the station so long, and I really appreciate the opportunity. It's such an important topic, so thank you.
You're very welcome. And thank you, audience, for listening and watching COVID Conversations here on WNCU 90.7 FM. I'm Kimberly Pierce Cartwright. Until next time, thanks.